Good evening and welcome to the March 1st, 2021 regular meeting of the Mayor and City Council. First item on our agenda is the Pledge of Allegiance, and I'd like to ask Councilmember Rob Wu to lead us in the pledge tonight.
Thank you, Mr. Mayor. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you very much, Rob. For our reflection tonight, which is the next item, I would note that over the last week, the total lives lost from the COVID-19 pandemic passed what was really what would have been an unimaginable number before this, 500,000. We're going to be discussing it more tonight with representatives from the county and talk about getting the word out about vaccinations. But in the meantime, the city, at least tentatively, is looking for ways to participate with communities across the state of Maryland on Friday evening by lighting our city hall in amber. And tonight, I'd like to dedicate our moment of silence to all those who we've lost and their families and their friends. Thank you all very much. Next item on our agenda is the approval of minutes. And tonight we have two sets of minutes before us. The first one is from the regular meeting Monday, February 1st. What is the pleasure of the council? Mike.
Mayor, I'll move the minutes of the regular session Monday, February 1st, 2021.
Great. Lorianne.
Second.
Okay, I will call the roll. All those in favor say aye. Any opposed say nay. Councilmember Harris.
Aye.
Councilmember Wu.
Aye.
Councilmember Spiegel.
Aye.
Councilmember Sales.
Aye.
And Councilmember Sesma.
Aye.
All right, carries unanimously. Next, we have the minutes from the work session on February the 8th. And I'll note Councilmember Wu was absent for this one. What is the pleasure of the council? Lorianne.
Mayor, I'd like to move the approval for the work session minutes from February 8th.
Thank you. Neil.
Second the motion.
Okay. All those in favor say aye. Any opposed say nay. I'll call the roll. Councilmember Harris.
Aye.
Councilmember Wu.
Abstain.
Thank you. Councilmember Spiegel.
Aye.
Councilmember Sales.
Aye.
And Councilmember Sesma.
Aye.
Carries unanimously 4-0-1, one abstention, Councilmember Wu. Thank you all. Next on our agenda is presentations, and I'd like to ask the tech team to bring up Richard Madalino and Dr. Travis Gales. Rich, you are muted. And
Good evening.
Before you go, before you start, I just want to give you a quick introduction. The illustrious Richard Madalino. I think in my 13 years, this may be the first city council meeting Rich Madalino's joined us for, so it's a big honor to have you here. Rich is the Chief Administrative Officer for Montgomery County. Did I get that right? Okay, and we have Dr. Travis Gales, who is the Chief of Public Health in Montgomery County and probably still warm from the Klieg lights of 60 Minutes last night. It's a great honor to have you both here, and I just want to, before you get into your presentations, say on behalf of our city, express our gratitude for all that you're doing for our county to help during the pandemic, to try to get vaccines distributed and into arms. It is much appreciated, and we want to work with you as best we can. So I'll turn it over to you guys.
All right, thank you very much, Mayor Ashman and members of the City Council. It's a great honor to be with you. I'm sorry I've never been before the Gaithersburg City Council before. I never had a chance to represent Gaithersburg. in the state legislature, but I've had the pleasure to work with many of you over the years. You wanted to hear a little bit about what the county government is doing. You can't hear from a better person than Dr. Travis Gales, our outstanding health officer. We'll go through a presentation that we update on a weekly basis. It is available. All of the data you're going to see is available on our public dashboard through a variety of documents that we put out. So nothing is private and not easily accessible. And if it's dated from last week, come tomorrow, there will be a new update that will be available once Dr. Gales and our emergency management, Dr. Earl Stoddard, go before the county council. And you can look at obviously both our dashboard about the virus and the case levels and deaths and the spread through the community, as well as our vaccine dashboard, so you can see what progress is being made within the community with vaccines. So we are nearing, as you said, a year since the very first cases in Maryland and in Montgomery County. Certainly during that time, the Eldridge administration has been focused, number one, on stopping the spread of the disease and certainly trying to stop as many deaths as we possibly could. And it feels like we are finally able to show up and talk about good news during this whole process that you can see as a county, we have been laser focused, and as a public health department, we've been laser focused on getting doses into the arms of first responders, medical professionals, and people over 75. And as a result, in Montgomery County and around the state, you can see by putting it into the 75 and old population, the population that was without a doubt the most hard hit by the virus and has had the most significant impacts as far as deaths and severe illness and complications, we have definitely turned the corner for that population in our state. I'm proud to say that as of this morning, we had vaccinated more than 150,000 Montgomery County residents. And by far, the Montgomery County Health Department is the largest vaccinator in our community. Hospitals are doing it. Giant, Safeway, pharmacies are providing vaccine. So there are lots of partners within the community, but no one is doing more shots than the Montgomery County Health Department. And to date, we have been able to vaccinate, we estimate 68% of county residents who were over the age of 75, 32% of county residents who are between 65 and 74. So a substantial number of people who are the biggest priority for the vaccination out of the CDC guidelines, out of the state guidelines. And we have been trying to do that. And you will hear also from both of us tonight, not only are we trying to do that, we're trying to do it in a targeted and equitable way so that every member of our community has the access to the vaccines. I had asked our data team to pull out some information that isn't in the presentation today, but that will show you for the zip codes that overlap the city of Gaithersburg. Obviously, the city is big enough that it covers multiple zip codes, and then the zip codes go out into other areas. But for the population of 75 and plus, who we estimate live in those zip codes that overlap Gaithersburg, 7,900 individuals, and 79% of them are vaccinated already. So we are moving ahead for the Gaithersburg zip codes at an even faster clip than we are for the rest of the county. So it shows the progress that is being made. I think it's interesting that Councilmember Harris has the enterprise, the original enterprise. Oh my God, I can't think of the
background.
The background, the bridge of the enterprise. And so clearly we are moving warp speed in order to get this done. And I'm using the general term warp speed, not the trademarked term that a prior administration used. So, but with that, I'll turn it over to Dr. Gales, who will go through the presentation, and I think you'll see over and over the numbers are going down. But I do, as we go through the presentation, I am going to interrupt him, hopefully, when he gets to slide 18. I just wanted to give you a warning about slide 18. All right, thank you.
Good evening, everyone, Mayor Ashman and council members. Thank you for the opportunity to be with you all. And I am happy to say I have sat before you all before, and it was actually in person pre-COVID.
That is correct.
Yes.
That is correct.
So thank you for the opportunity to be with you all again. And thank you for your continued advocacy for the residents of your jurisdiction and municipality. While I don't get to meet you all regularly, I know that we speak with Tanisha regularly, and she represents certainly for the residents of Gaithersburg in our municipality calls on a bi-weekly basis now. And I do believe the presentation will be brought up. All right, now I'm going to reprise my teaching role where we're going to move through this quickly, so buckle your seatbelts. We'll highlight the key points to save time for questions. Rich highlighted a number of key points in terms of how we're moving forward. And I will say the highlight of last night's 60 Minutes presentation was it showcased a whole host of different people who participate on the response. And that's the key. And I hope folks at home understand all of the different intricate pieces that go to rolling out these things and the logistical issues that are involved. And it was exciting and nice to see representation from all of the different members of the team, because I think that one of the challenges is when we are critiquing and trying to improve systems that have caused frustration and not necessarily working how we want them to work, we lose sight that there are a lot of people who are still working very hard to get the resources out to folks. And so I want to say a special thank you to everybody, not just the folks working on the vaccine, but collectively throughout the pandemic response. Your work is valued, appreciated, and we could not be here without you. Next slide. All right, just an update in terms of level setting where we are. As you know, this is a representation of our 7-day average of our case rate per 100,000 residents. The first wave was where we were hit in the early part of the pandemic, and the second wave is where we saw the significant increase in cases experienced over the winter holidays into January. We are seeing improvements in those numbers, but as you can see, we've not yet achieved those levels of where we were in the summertime, where we did start to reopen things. We still are at a high risk of transmission based upon CDC classification, as well as we are continuing to understand or gather an understanding of what the impact of variant strains are present in our community. We have received notice that we're likely to see an increase in variant strains, whether we're talking about the United Kingdom version, the South African version. Those are the two that we have had documented cases within our region so far. Reports suggest, though, that across the board, across the country, those will become the dominant strains of COVID-19, potentially as early as the end of March. The reason why we're concerned about those is because they are more contagious than the novel wild strain that we saw throughout most of the pandemic so far. And we're very careful to watch the numbers and how they move in the setting of those numbers, because we certainly don't want to open up too quickly and see a rebound in cases and put us back to where we were at the second wave. Next slide, please. So this rolls out and how many doses, and again, this was as of Friday. It doesn't include the Friday doses as well as doses that we put out today, but we have achieved approximately vaccinated over 12% of our population and are getting up there in terms of our second doses applied. Now, when looking at the priority groups so far, everybody else, separate from the county apparatus, is providing vaccines to 1A, 1B, and 1C categories. The county-specific clinics are providing vaccines for 1A groups as well as our 1B group, the 75 and up crowd. That's who we're prioritizing. And as Rich pointed out, we are just shy of 70% of that population vaccinated so far across all of our different opportunities and mechanisms. Next slide, please. This shows you how we stack up in comparison to other counties in terms of the raw number of vaccines administered between first and second doses. As you can see, we have distributed more vaccines than any other jurisdiction across the state. And then the other one on the right shows you the percentage of population that has been vaccinated so far. And so it's a little misleading because 12.2% of our population is over 120,000 folks, which we know is actually more than the population of a lot of other counties throughout the state. Next slide. This shows you, again, the breakdown of how many doses we have received versus how many that we have administered. And again, this was as of Friday morning. And since then, we have now, I believe, the amount of doses that we have administered is, I believe, over 75,000. And that's inclusive of what we did on Friday, as well as we did have a pop-up clinic with our colleagues at CCACC and the Pan Asian Clinic, which I believe may be in Gaithersburg or Gaithersburg adjacent.
It is in Gaithersburg.
Okay, there we go. And so they added another nearly 300 doses, and I don't have today's report in terms of what we did in putting out doses at our multiple sites. So that discrepancy between how many administered and how many have been allocated and delivered is actually much smaller than the 11,000 noted here. It's probably just shy of 2,000 doses between.
We are in fact at 76,497 doses administered.
There we go. So, and by virtue of the reporting week, it's a Wednesday to Wednesday. So we are just shy. We're well over 98 to 99% of the doses that we've received. Next slide. And again, this just breaks down and shows the percentage of doses. And this was using Friday's numbers. And so as Rich has pointed out, we're at 76,000 of the 78,000 that we received. That number is closer to there. Next slide. This shows that, again, want to emphasize that the county apparatus is not the only source of vaccines throughout our community. Our health systems and hospitals, they were in fact the group who received vaccines first to start vaccinating healthcare workers. But this shows you how our health systems and hospitals stack up in comparison to other health systems across the state. Next slide. And to pivot from doses administered, here's information that shows you where we stand in terms of the number of folks who have pre-registered in our system. As you may recall, we created a pre-registration system that allowed folks to pre-register so that we had their information, so that when it was their turn in terms of prioritization group, we could send them a registration link. I'm sure you've heard all about the registration links and the controversies that have been there, but we were able to have their information and send a registration link for them so that they could move through the process. Now, in looking at the breakdown by race and ethnicity, certainly this is not representative of the population breakdown of the county. It has improved over the last couple of weeks, and we do have ongoing efforts and partnerships with a number of community partners, including our minority health initiatives and program, to help increase the diversity within the pre-registration pool, because ultimately that's what we have been pulling on to be able to share the online link for people to get registered. Next slide, please. This just breaks down pre-registration statistics by occupation and high-risk categories. Again, not a surprise that we have a lot of folks who are from a high-risk medical background, considering how the prioritization groups have been stood up so far, giving priority to healthcare workers and healthcare situations, as well as nursing homes and long-term care facilities. Next, please. Again, just more representation of how the changes have happened in terms of the number of people registering by age as well as by race and ethnicity. And again, the encouraging sign is that we have seen increases in registration, pre-registration from the Black and Latino communities within the county. Next. This is a heat map that shows kind of the geographic distribution of the pre-registration, particularly for those over 75. And I do want to take advantage of this opportunity to highlight So how we determine moving to the next stage is we're not waiting for 100% of people to be vaccinated before we move to the next stage. What we are hoping to create is the opportunity where we have pushed out registration opportunities to get an appointment to everyone who we have pre-registration information for that group. Then to move to the next phase. We recognize that when moving to the next groups, there will be people who will continue to be a part of those previous groups who will want to be vaccinated. They will continue to be allowed to do so. We will not be shutting the doors to say, if you're 75 and up, you can't do it anymore as we move to other groups. They will continue, it will be a fluid process, and they will continue to have access to the system. Next. And again, just as a geographic representation using census tract data in terms of distribution of pre-registration, particularly for those over 75 throughout the county. Next slide. We have attempted to, as Rich pointed out, utilize an equity framework, because we do know that the surveillance and epidemiologic data has clearly shown that there are certain zip codes and certain racial and ethnic groups who have been disproportionately impacted by COVID-19, both in terms of cases as well as fatalities. The same approach was taken to figure out and determine where we stood up testing opportunities. The Gaithersburg zip codes benefited from that. Unfortunately, because there was a high percentage of cases and impact on those zip codes. So we made efforts to stand up testing opportunities strategically located in those areas. And keeping with that framework, we have worked to try to prioritize and make sure that doses are allocated with some respect to the disproportionate impact of COVID on zip codes, as well as certain racial and ethnic groups. And so this is the prioritization of those zip codes that have received higher prioritization and consideration based upon those equity concerns. Next. And this just breaks down the county demographics by age group. Next slide. And here's the vaccine percentages that have actually been administered by race and ethnicity. And you can see that, again, the percentage vaccinated is in blue and the percentage of the county population is in gray. So while we are seeing improvements, there's still some significant gaps from where we stand in terms of the representation of those vaccinated to match up with the county representation for population. Next slide. And then this just looks specifically at those over 75, and you continue to see some of those same gaps in the general population. Next. And this shows, again, breaks it down by race and ethnicity, comparing pre-registration with county population percentage, and then looking at the percentage of COVID cases versus the percentage of those who've actually been vaccinated by date. And so as you can see, for example, two communities that have actually been, when breaking it down, for example, the Latino community, makes it 40% of COVID cases with the information that we do have, recognizing that we do have a good percentage of not reporting race and ethnicity and the data, but only 5% of those who have been vaccinated to date. And similarly, when we look at Black residents, 19% of cases, but only 7% of those vaccinated to date. Next slide. This just shows how the breakdown of vaccinations provided by different providers, and then the racial and ethnic background and mix within those different places. Next slide. What the consensus is that, again, consistent with the previous slides, we need to increase, diversity within the representation, and that underscores, again, a lot of the work that we are working with our community partners and different initiatives to work to increase the number and representation within our pre-registration system. Now, I want to shift to answer a question. Lots of folks say, well, how are you prioritizing? Why is it that certain occupations get preference? Why is it that certain ages get preference? Why is it that certain races and ethnicities, and why is it that certain geographies and zip codes get preference? Well, one of the core fundamentals of public health is when we identify certain factors, we call them risk factors, of a particular outbreak, When we come up with strategies, it's important when we identify those risk factors to assess risk. And when we identify certain factors or certain traits that carry higher risk status, then it's incumbent upon us, again, core fundamental of Public Health 101 is to make sure that we prioritize and have strategies in place to address those populations who've been deemed higher risk based upon different factors that are informed by surveillance data that clearly shows us, again, that COVID has had a disproportionate impact in certain zip codes within the county, as well as certain racial and ethnic categories, as well as age. And when we look at our COVID-related deaths, the majority of deaths, over 50%, have been in our 80-plus population, an additional 21% between 70 and 79, and then 13% between 60 and 69. So collectively, if I do my math really quickly, that's 88% of deaths in Montgomery County, COVID-related deaths, are in individuals over the age of 60. So that explains and underscores why there has been this approach to move through from an age-related perspective as far as prioritization. Next slide, please. And then this breaks it down by the relative risk associated with age and underscores that the older you get, your relative risk of dying from COVID, should you contract it, increases significantly as your age increases.
And this is the slide I wanted us to linger on for a second, if you don't mind me interrupting Dr. Gales, but just to show dramatically to the population why we are focused on, especially that 75 and older. Look at the impact when you adjust it proportionally across the different age groups. You can see that people over 80 have died at 4 times the rate of people in their 70s, and they have died at 3 times the rate of people in their 60s. So this is where you see the dramatic impact on one segment of our population, which is why we are focused on that 75 and plus, because that's the prioritization of where of the moment, and where we're seeing the greatest impact. And we are called as the county health department, as you've heard from Dr. Gales, to actually go in and find as many people as possible, because that's the role of the public health department. And we have to adjust for and try to solve the problems of an equitable distribution around the county. So yes, while people have said, why aren't you moving to other groups? What about these other tiers? And why aren't you moving as quickly as other parts of the state? Because we are trying to get to every person in this age group, because we know that this vaccine has the ability to keep them from dying. The amazing thing about all of these vaccines, they have been 100% effective against people dying. And isn't that what we want from our community? And especially, we know we have to go in and address and try to provide vaccinations in communities where there are barriers because of income, because of language, because of race, ethnicity, access, digital access. We have a special purpose to try to make sure we try to overcome the hesitancy that some people have towards vaccinations, because these vaccinations have proven to be so successful. So I think this graph, more so than probably anything else, shows why this moment is so important for this community, to continue to make sure everyone over 75 who wants a vaccination can get it, and why we need to do an extra effort to make sure we convince everyone over 75 to get that vaccination. And it's very important to remind people, just because the Montgomery County Health Department is focused on this segment doesn't mean other people who are eligible under state guidelines can't go elsewhere. You can go to Six Flags in Prince George's. You can go to the mass vaccination sites in Baltimore. You can go to Safeway, Giant. And we're not trying to tell other providers within the community that they should not be also providing vaccinations for the people who are eligible under the state guidelines. But for us, for the special mission that Dr. Gales has so eloquently talked about for almost an entire year and has worked on for almost an entire year, this is why we are doing what we're doing.
I've got nothing to add after that. There we go. That's the take home. Next slide. Again, this just breaks down the death rates by racial and ethnic distribution. Next slide. And this just, the next few slides will just go through quickly, show who's covered in those groups that have been vaccinated. You can flip through, next. And so the groups that will be coming next would be the remainder of the remainder of group 1B and tiers 2, which would include a host of essential employees in different categories, and individuals who are moving to tier 1C, at least the first tier, who are over the age of 65. Next slide. All right, I don't think that involves me, but we'll stop there, and happy to answer any questions that you all may have. Thank you for the opportunity again to be with you all.
Thank you so much for the presentation to both of you. I know everyone's got questions. I saw Neil's hand, I saw Mike's hand. Let me just start. I was in a meeting a week and a half ago with Rich, with the mayors of Rockville and Tacoma Park. And they were, as well as the county's Office of Community Partnerships, and they were talking about how important it is for the municipalities to work with the county to get the word out to our more vulnerable populations, to encourage them to register, even if we don't have the vaccine inventory yet, to get registered to get the vaccine. I just wanted to give you, Rich, or you, Dr. Gales, whoever wants to take it, the importance of getting the word out to anybody who's listening. How important is this?
It's extremely important, and I'll just share an example of what drives me. So this is my job, but I'm also a human. I'm a son, I'm a family member, and my parents were able to get their first dose 2 weeks ago, and I can't describe the sense of relief and the emotion I felt from when getting that call to say they happen to be where they live in rural Virginia, and the health department provides the doses for them. The closest Walgreens or CVS that's offering doses are approximately 2 hours away. I've mapped everything out to try to figure that out. And when they called to say they had an opportunity to get it, there was some bad weather there, but I said, you know what, drive 15 miles an hour and take your time to get there, but I need you to go right now to get those doses. And I share that example because everyone should be able to feel that sense of relief, whether it's for your parents or for yourself or for family members. And in order for us to really try to continue to move forward to do that, we need your help. So we've set up infrastructure to get out the doses. If you saw the interview last night, you could see we could expand that infrastructure to do that. And while we're waiting to get more doses, we need to make sure that we have your information. And we do recognize that access to technology, whether it's a computer or a smartphone, is an issue for folks. So we're working to set up systems where you can call our disease control hotline. If you don't have access to that, to schedule an appointment or get coordinated and get pre-registered so we can get your information. And we're also looking at how we can leverage, again, some of our community, not leverage, but work with our community partners to be able to set up some venues that may be able to overcome or offset some of those logistical concerns from a technology perspective. For example, we had an event at the East County Rec Center last week, where we were able to recruit a number of folks in and do some different things around registration. They were all eligible by virtue of age, but folks who had not been a part of the pre-registration process. So I encourage you, if you're at home and you're able to pre-register yourself, please do so. And if you have family members, neighbors, friends, relatives, anyone who needs assistance with that, help them out as well. Because by getting their information, we have a better sense of who's still in need. And that gives us an opportunity, as we're going through trying to send the links out to folks to get them covered, we have a better sense of who they are.
I would add that last week, as you saw on the 60 Minutes piece that aired last night, we operated, they filmed at a clinic that we had up and running at the East County Rec Center, where we featured, I think, vaccinating a 100-year-old World War II veteran. There was a clip of that as part of the segment. And not to get too personal, but as I was there and I was looking around the room, I did start to tear up because, as some of you know, my father died of COVID in the early part of December. So at just the age of 78, and he went from what seemed like a healthy person the week before Thanksgiving to dead 3 weeks later. And it's a horrible death. It was alone. As a family member, it was a horrible death to go through because you couldn't be there. For my grandparents, I could be there. You could hold their hands. You could say goodbye. You're denied that with this disease. If you have an opportunity to get someone a vaccine that's going to keep someone from dying, keep someone out of the hospital, keep a family member from having to experience that, I don't know why we wouldn't want every person in the community to get vaccinated. I don't know why every person wouldn't want to do that, just to protect themselves and their loved ones from this moment, and how debilitating and awful a death from COVID is, what I experienced with that, which is why it's so incredibly important that we reach out and get all of our friends, our neighbors, our family members vaccinated, because it's the way we're going to defeat this disease, and it's the way that we're going to protect ourselves, and it's the way that we're going to move forward as families, as friends, as neighbors, as communities, and get the community back up and running, schools and businesses. We all want to go out to meetings. Honestly, God, that's how I'm sure how interesting we all are. We would love to be in this meeting together in the same room in the city hall. We would love to be at a restaurant. We would love to be at a movie, and the vaccine is the path to getting that done. I would also encourage people, the state has a toll-free line to set up appointments at sites around the state. That's 1-855-MD for Maryland, MD Go Vax. So 1-855-MD GOVAX, MD Go Vax, which also translates into 855-634-6829.
Thank you. Thanks for that. I hope everybody was listening to that. And I want to also thank both of you for sharing such personal stories that really, touch all of us. And Rich, we're so sorry for your loss. We all saw it in the paper and heard it in the community and saw it on social media. And we were just very, very sorry, sending our best regards and condolences to your family.
Thank you.
So with that, I'm going to go first to Neil, and then to Mike, and then whoever else wants to ask questions. Go ahead, Neil.
All right. Again, thanks for the presentation. I'm sure you can understand why I'm hiding out in outer space rather than facing the virus on Earth. Couple of questions. One, I'm going to pass along because I had a phone call from a constituent here in Gaithersburg today who is trying to get vaccinated for himself and his wife. They're in the 65 plus category, and they're wondering why we haven't been able to set up a mass vaccination site here, why they have to go. They actually have just made appointments to go to M&T Field up in Baltimore to get it done. And let me ask a second question, and then I'll let you go, which is for people in the county who get vaccinated outside of the county, are you guys getting that information and able to keep track of it? Do the individuals have to provide it to you directly, or are you getting it from Johns Hopkins or whoever else is doing that for our residents for us? Thanks.
Well, the first one is unfortunately an easy answer. So the state coordinates the mass vaccination sites. We don't do those as a local jurisdiction. And to those watching at home, if you followed along in the news, we have requested that we be a site for a mass vaccination site at the state, from the state. From my understanding, they're considering it at this time. We don't have definitive answers if we'll get one. We have presented a number of locations as alternatives to provide that site. And From my understanding, there are conversations ongoing, but the state mass vaccination sites are just that. They are run and operated by the state. We don't run those as a local jurisdiction. And so as to why we don't have one, I can't tell you that answer. You'd have to contact the folks at the state to get a better understanding of how they're making those allotments. But we're hopeful that as they continue to stand them up in other parts of the state, that we will be able to get one here so that our residents will be able to benefit from that opportunity. At the same time, we are continuing to advocate for an increase in doses in general to the health department, as well as to our other facilities across the county, including our hospitals. We do know that, and unfortunately, we didn't have any information to share with you. We know that retail pharmacies have been receiving doses as well. And so we continue to advocate and say, please send as many doses as you can to Montgomery County through these different networks. So you're right. Our residents shouldn't have to drive hour upon hour to get to other sites to benefit from those opportunities. We're hopeful that we'll have more local options here. And the second question, could you repeat the second?
Was about Immunet, and that, yes, in fact, all providers across Maryland do feed in results into the same database. So we can keep track of anyone vaccinated anywhere in the state by any provider across the state. So we know that 72 Montgomery County residents have shown up at the Denton Walmart to be vaccinated, and we know the demographics of those people. What we don't know is people vaccinated elsewhere outside of the state. So we know, for example, more than 10,000 Montgomery County residents have been vaccinated in the District of Columbia. Close to 1,000 have been vaccinated by Fairfax County. So, but we've learned those numbers through just information sharing from COG. Not in any sort of formal manner. And let me tell you, on to your first question, County Executive Eldridge, the members of the County Council, every day they are pounding on the state administration to get a mass vaccination site in Montgomery County. There's nothing the state could do that would move the needle more as far as getting their numbers up than putting a mass vaccination site in Montgomery County because of both the desire for the vaccination and the system that we have here, the partner that we're ready to be to get that lifted up by the state. So every day, countless emails go back and forth, conversations. The governor, the county executive has spoken to the governor about it. So we are trying each and every day to get that happen. We could have a mass vaccination site if they just gave Dr. Gales the number of doses to make it happen. We're capable of doing it if we just had the doses. Easier said than done. I'm not saying the state is sitting on a pile of doses. They aren't, but as more come in, they should give it to us because we can get it into arms.
Have you reminded them that this is the most populous county in the state?
Yeah.
So I have tried all sorts of different angles, even reminding them that if you want to call it a Western Maryland site, you could call it a Western Maryland site. Gaithersburg is in the Western Maryland congressional district. It works.
Well, just so before we go to Mike, just so you guys know, Tanisha and other staff and I had a meeting a couple weeks ago with the governor's staff and made the same request directly to them. Like we suggested Gaithersburg, either Lake Forest or the fairgrounds could work. So we're trying to on our end. Yep. We'll go to Mike.
All right, thanks very much, Rich and Travis. It's very informative. I think what came across last night with your 60 minutes discussion and what's become clear is that the most important variable here is the number of doses that are available in Montgomery County. It's been frustrating for myself and my wife being in Tier 1C to not have had an opportunity to register, not to register, but to make an appointment anywhere in the state, including in Montgomery County. So I guess the biggest question is how many doses are actually available to Montgomery County on a weekly basis? And, you know, if we know that, at least we have an idea how long we're going to be waiting before we might have an opportunity to make that appointment. So can you, I know that the county itself, the health department gets 4,500 doses on a weekly basis. That's correct, right? So across, between Montgomery County, the hospitals, we've got 4 health systems, I believe. that serve Montgomery County, plus the pharmacies, the retail pharmacies. How many doses across all of those are available just to Montgomery County?
So we're averaging somewhere between 12,500 to 15,000 doses on a weekly basis. The last couple of weeks, that average has been closer to the 12,000 in versus the 15,000. And that's inclusive of the health department and all of those other places that you described. And so by law of averages, if you take 12 to 15,000 a week, let's just say so the 60 Minutes interview, we actually talked for over an hour. And it's interesting to see what was cut and put into the interview. But we did have a segment about that where we just did simple math, and we said 12 to 15,000 on a weekly basis in a population of 1.1 million people. It's going to take a while to get there. Now, that said, we've tried to be strategic in getting those doses out to hit the priority group, the age group, so again, that we could open up and move forward. And it's important to emphasize that, again, 65 and up, and anyone in the 1C category, including 65 and up, has been able to get vaccinated at those other places. But unfortunately, in recognizing that, there's not a lot of appointments available, and it's first come, first serve, and difficult to do that. So that's why we've been really trying to push and get as many appointments out to those who are 75 and up, to get as many covered, again, so that we can move and pivot to those other groups. We're hopeful. I don't want to speak out of, I don't want to say too much, to commit publicly, but we're hopeful that we'll be able to announce in the very near future our ability to be able to potentially move to those other groups. And so other folks will have an opportunity, at least for the county apparatus, to be able to take advantage of the doses that we do receive.
So the next, the vaccine, right now it's Moderna and Pfizer vaccines. Johnson & Johnson has been approved. How quickly will that be able to, how quickly will the third vaccine be available in Maryland, in Montgomery County, and how big an impact will that have in terms of addressing the overall need in terms of the number of doses available in the county? Do you have any ability to comment on that?
Sure, it's perfect timing, actually. So J&J dose was approved over the weekend, and then the Committee on Immunization Practices is meeting. Their meeting concludes today to provide additional guidelines in terms of how to use it, if there's any particular groups that we should focus on in terms of using it and distributing it. What we know so far is that there's approximately, some have said 2 million, some have said 5 million doses of the vaccine available right now. From what has been shared with me, and my understanding is that the federal government is pushing all of those out as quickly as they can and not keep holding any back. The state of Maryland will likely receive somewhere between 49 and 50,000 of those doses, potentially as early as tomorrow. And we as a health department may receive somewhere in the neighborhood of 15 to 1,600 of those doses potentially as early as tomorrow, more likely on Wednesday. And so we are awaiting further guidelines to see if there's any contraindications or special indications from ACIP in terms of how to administer those, and if there are any populations that we should prioritize those for or stay away from, which is why we haven't made any public announcements about how those doses will be used. Now, from a numbers perspective, it increases the number of doses available. And so it does create opportunities to increase points of entry for folks to be able to utilize and take advantage of. And again, I want to be careful though. Again, we're awaiting further guidelines to see, how to best use it. If it's, if they come out and say you can use it for anybody can take advantage of it, or if there's any special considerations that we have. But just on the surface, it will increase the number of doses short-term immediately available to offer to people.
The governor announced that the state would receive 49,600 Johnson & Johnson doses this week and get it out through the whole system. Some will come to us, some will go to the hospitals, but that's a great, good pun intended, shot in the arm when it comes to the amount of doses coming in. And when you look at some of our partners in hospitals, so that people understand kind of the other flow that's coming in, the Hopkins system was getting 3,500 doses with 2,000 dedicated to suburban. MedStar operating Montgomery General was getting pretty much close to 3,000 doses. Holy Cross for both Silver Spring and Germantown was getting 1,700. Adventist in White Oak was getting 1,400, and Adventist at Shady Grove was only getting like 400 doses. So that's how the state has assigned the doses out through the providers. You know, there's doses going to Safeway. There are 2 Safeways in Montgomery County with pharmacies that are offering vaccines. There are 5 Giants that are offering vaccines. So it's spreading out through the whole network. And I think with both the Johnson & Johnson announcement and the fact that Pfizer and Moderna are also expanding delivery, there was an announcement that there would be more Pfizer and Moderna vaccines hitting the whole system this week as well. So you'll see a big, a good step up, and then hopefully more each week moving forward.
Okay, and so in answering questions that I'm getting from various, constituents and others, is that once you're pre-registered, you don't have to keep doing that again for each of these locations, correct? Then the next thing you're going to be waiting for is notification that appointments are available. Is that
So
correct?
not all of the systems talk. So
Okay.
if you are pre-registered for the county system, you don't have to go back and pre-register for that system. But then, if you're trying to register at Holy Cross or Adventist or, the state sites, unfortunately, the way the system's set up right now is there's different pre-registration processes for each one. We're hopeful that as we move forward, there may be some thought into consolidating that to make it easier for everybody. But currently, most systems are separate.
Okay, so that I would say if is some solution going forward, just to ease some anxiety, is this whole process of pre-registration to make the appointment. And I think that, my efforts have been frustrating because it appears that you're not always even able to pre-register at some of these sites, as opposed to, I'm pre-registered with the county, I'm pre-registered with MedStar, with Kaiser, with Adventist, and even at one of the state mass vaccination sites in Baltimore, but not the other one. So, and then I haven't been able to get, our experiences, we haven't been able to get pre-registered at Six Flags. So, it's just, we consider ourselves reasonably savvy to the internet and to the World Wide Web. And if we're having these frustrations, I can't imagine how it's working for people who have limited access and limited ability to work on the internet and on these sites. So, and that's part of our problem with this disparity in racial and ethnic groups that are being hit the hardest by the pandemic.
So the state said they were bringing on 500 more call takers today to the phone number I gave, 1-855-MD-GO-VAX, to help people call. And it's supposed to be open, I think, from 7 a.m. to 11 p.m. for people to be able to call and get assistance in finding appointments around the state. And remember, you can go to multiple places around the state. You are not just confined to finding a location within Montgomery County, and Montgomery County residents are going everywhere, which is why we're the #1 vaccinated community in the state. But I would also say that, one of the things, there's no wrong door for finding a vaccine, but they also handed you a set of keys that have no labels on them. So it's, you've got a whole bunch of doors to possibly get into, but you can't get into any one, and it's incredibly frustrating. And we know that, and we are pushing to get more out. But remember, we are targeted on where the vaccine can do the most to stop death and illness now. And the great thing is the numbers are showing that is working. It's working here in the state and around the country to stop deaths amongst the most vulnerable age group within our community and within our country.
Okay, thank you. I'll hand it to the next person.
Thanks, Mike. We're gonna go to Rob and then Ryan, but before that, I think Tanisha's got a question.
Thanks, Rich. I just want to make sure you clarify one, that the county local health department is not responsible for this myriad of doors, and that is this, that the state can take some action around that, and we want to continue those conversations. But also, it sort of sounded like you were saying that 1-800 number can be used to make appointments at all of the various doors, and I don't think that's the case. So I just wanted to make sure that you clarify what that phone number can be used for.
So the way they advertise it, and it's 1-855, not an 800 number, but an 855 number, MD Go Vax. You can certainly get it to get the appointments for the state mass vaccination sites. And they also did say that they would help people navigate their way to other appointments around the state. It's not necessarily going to get you one. It's not going to necessarily find a way to get you one in Montgomery County, but they have said that they were using that as a way to try to find people appointments, whether it's through one of the state operated sites or elsewhere in the state.
Thanks, Rich. We'll go to Rob Wu.
Thanks, Mr. Mayor, and thank you, Rich and Travis, for your information tonight and for your personal stories. I do appreciate, Rich, that shot in the arm joke. I was laughing. So kind of dovetailing on what Mike was just talking about, my wife has had her second vaccine because she's an educator up in Frederick County. But I recall going through the process with her of trying to get, finding a vaccine. And it really is, I heard somebody refer to it as like kind of the Hunger Games. And you have to go to all these disparate sites. She registered with MedStar, with Shady Grove, with the county of Frederick. And it really is frustrating. But my question is, I had heard, or maybe it was I read online, that the state had contracted to put a single face to try to unify the various disparate systems. Maybe it was a week ago that I saw that. I was wondering if you'd seen anything on that, and if you have, is that forthcoming?
The state has decided to launch a registration system for its own sites. So right now there's a separate one for Six Flags, the Baltimore City Convention Center, the Ravens Stadium. They hope during this month to unify all of the platform for all the mass vaccination sites. The state says they're going to open 3 more. They've announced one for Charles County. That will all use the same platform. For the rest of us, we will still be using our individual approach to pre-registration and to use the registration system that we already have that the state provided, that has so many glitches in it because it was never designed for a vaccine program where there would be vastly more demand than supply. It's great for the flu season when there's plenty of supply. When there's a huge demand and supply issue, it's created lots of issues. So yes, the state made that announcement, but they made it for their own mass vaccination clinics.
Okay, yeah, because the current website, you go to it, you enter 20878 where I live, and it gives you, within 25 or 50 miles, the appointments that are available at the mass at M&T, at Six Flags and whatnot. And then it launches you to the other sites, to like Shady Grove, to Adventist, to CVS, and it's very difficult. So thank you for that information. I'd also heard that the county, as a proportion to its population, is not receiving as many vaccines as other places in the state. Can you confirm or deny that? Is that still going on?
I think that's fairly accurate. Yeah.
I mean, if we're getting 4,500 doses and Prince George's is getting 4,400,
Baltimore County is actually getting 4,900.
Right. So, and they're a little bit small. They're they're probably at 800,000. So it's much better than it was when they were telling us we were only going to get 925 a week, and the smallest counties were getting 300. So, they have widened the gap a little bit, but still it is greatly disproportionate.
Do you know if the mass vac sites count towards those numbers? So does the allocation to Baltimore, does it count the Raven Stadium? Does the allocation to Prince George's count? It does not. Okay, so
yeah.
So the allocations to the health departments don't count in that. The state's response to us when we've said our numbers don't match up is, well, if you look across the board, collectively, you as a county and all of your sites are receiving these many doses. So that's the math that is used from the state to reflect back and say, well, even as the health department, you're not getting as many. We're still sending it to these other places across your county.
Okay. All right. Well, thank you very much for all you're doing and for the information. I will point out that Mayor Ashman is best friends with Larry Hogan. So if you want to, influence anything, talk to him. Thanks, Judd, Mr. Mayor.
Appreciate that. It's all my fault.
We've got the mayor on speed dial because we know that. I mean, if there's something we need from the Hogan administration, that's.
All right. Okay, we're going to go to Ryan.
Thanks, Mr. Mayor, and thanks to both of you, Rich and Dr. Gales. A number of us, including myself, have spent many years working with Rich on lots of different things, and I just want to say how much I appreciate all of that work and the relationship. But for both of you, including Dr. Gales, over this past year, your diligence and your passion on this issue, which has come through tonight, we really appreciate it. And I'd say we appreciate your sense of frustration, which we share, which certainly Dr. Gales came through in your 60 Minutes interview yesterday. And I'll also offer my condolences to you, Rich, and to your family. But we appreciate you both sharing a little bit of your personal stories with us, because it humanizes all of these numbers and all of these sort of clinical discussions and statistics that we're talking about. Because at the end of the day, that's why we're all so concerned about this, is the very personal human impact on all of us. You've heard from a number of my colleagues, their own stories about trying to get the vaccine for themselves or their loved ones. I certainly have gone through the experience of spending many hours late at night on the internet trying to get vaccine appointments for my parents and my in-laws. And so I think even for those of us who benefit from a lot of privilege and a lot of knowledge and savvy about how our politics and our systems and our health system and our government work, if we're going through this, as you talked about the equities here, so many other people who don't have that privilege and those opportunities, are suffering so much more as they try to get access and information about vaccination. And we're, of course, as the most diverse city, the second most diverse city in America, I guess we're just renamed, and the most diverse small city in America, highly attuned to this issue of equity as well. And at the same time, also very proud to be the place where AstraZeneca and Novavax and Emergent Biosolutions, who's manufacturing the Johnson & Johnson vaccine, call their home. But the fact that those companies call their home, which is of great economic development benefit here, doesn't mean that we, somehow have some magic insight into how to get the vaccine to the people who need it. So we really appreciate our partnership with you. I'm going to ask a couple of questions. I think my colleagues have already asked a number of questions that I have been interested in, so I won't rehash those, but I'm going to ask a couple of questions to you both. And I just want to preface them by saying we understand, as has already been discussed tonight, that the county does not control or decide a number of things that we're dealing with here, including how many doses your health department gets, what other providers like hospitals and retail pharmacies are doing, what rules they're following, what the state is doing with its own mass vaccination sites. So when I ask you some questions that may spill over into some of those types of issues that the county really doesn't control, mostly I'm asking those for the benefit of the viewing public, to give you the opportunity to talk a little bit about what those impacts are and how that affects your ability to do your work, and what we as your partner can do to help, although we are limited, what we can do. So with that in mind, the first thing I wanted to go back to some of the slides that you talked about, the data on pre-registration. later in the conversation, it was mentioned that the county health department doesn't actually get the pre-registration data for people who sign up for pre-registration systems through other providers, whether it's mass vaccination state sites or whether it's private pharmacies. So is it fair to say that the data that we have comparing pre-registration of people within the county versus the number who've been vaccinated doesn't incorporate the pre-registration in other places?
So the pre-registration that we have that we're sharing is just what we have as a county. When we're talking about the percentage who've been vaccinated, that is inclusive of everybody, not just from the county system, because we are, as Rich pointed out, we are able to utilize the Immunet system that gives us a picture of what percentage of our total residents, again, regardless of where they were vaccinated, as long as they're vaccinated in the state of Maryland, what percentage of folks are covered within that.
But if you assume that the census shows there are about 72,000 people over 75 and over, and we had 66,000 people 75 and older sign up for our pre-registration system. So I don't think we were missing many. There could be some overlap there, but we had a hefty number of people sign up for the pre-registration system. So I don't think people are going to place to pre-register, just as you heard from Councilmember Wu. They're hitting as many places as possible.
So I appreciate that. So it's not a significant variance as a result of that issue. So the data, I guess it's sort of a softball question to let you say that the data is still reliable in terms of the way that we're comparing those different categories.
Mm-hmm.
Yes.
Great. Okay, I appreciate that. Putting on my Maryland Municipal League hat for a minute, but also just as a council member for Gaithersburg itself, one of the things that we've been thinking about is vaccine access or priority for our own municipal staff, local government workers, particularly those who interact with the public. I believe our city police department has already had access as first responders to the vaccine. But can you talk a little bit about what is the status of access to the vaccine for either county or municipal or both government workers, particularly those who'd be considered sort of essential or frontline in working with the public?
So continuity of government is a broad term. We've actually, Tanisha can tell you, we've spent a lot of time on the municipality calls, defining that based upon what's been provided to us from the state. But as we have in our prioritization framework, continuity of government, which would include many frontline staff at the municipal level, would be in the 1C category. I believe it's tier 3. After those who are 65 and up, the 16 to 64 folks with medical conditions, and then they would be included in that next set of folks within that.
Great, thanks. Just like the county's trying to look out for, its staff who's hard at work, at risk.
Sure.
We're trying to do that at the municipal level too, of course. Councilmember Wu talked about his wife's experience as an educator getting the vaccine in Frederick County. Again, with the caveat that we know that you don't control the school system and that it's not entirely clear how the state comes into play or other providers come into play here. Can you give us your best sense of the status of educator vaccinations in Montgomery County? And I won't ask you to talk about reopening schools because I think that that's sort of outside the scope of the presentation tonight. But if you have any, summary insight as to, how that's going, particularly with vaccinating teachers, I'd appreciate that.
Sure. So as part of back in the beginning of January, as we started the vaccination process, we asked our public school as well as our non-public school leadership to go through and prioritize staff as best as they could based upon, for non-public schools who were in session, their level of exposure based upon the type of work that they do, and for the public schools to prioritize the staff based upon who would be going back first in their phased in approach. And that's inclusive of teachers, bus drivers, cafeteria staff, and other folks who keep the schools open. because we recognize that we would not have enough vaccines to vaccinate everybody. I think MCPS had 25,000 folks. And then as best as we could estimate with non-public schools, that's probably somewhere between 10 to 15,000 folks there collectively. And so with that in mind, when we did have an opportunity to provide vaccinations through, as Rich mentioned earlier, through Suburban Hospital, the state earmarked a number of doses there to help provide outreach to educators. We linked them with the public schools as well as the non-public schools to be able to offer doses there. From my understanding, if I quote this correctly, as of Friday, there were approximately 5,800. So MCPS identified 9,000 staff for their first wave to go back to school March 1st. And as of last week, there have been, I think, 5,800 folks who had a first dose appointment already, and another 1,300, I believe, who had an appointment scheduled between then and Monday. And the non-public schools, as part of the Hopkins coordination, I believe we're somewhere in the approximately 3,000 staff members who had been vaccinated or had a first appointment as part of that program. Since then, we have been working with additional clinical partners to offer opportunities for those staff members who remained. Again, it's not clear if some of those individuals decided not to get the vaccine. We just wanted to make sure everybody had been offered the opportunity to do so. And so we've been working behind the scenes for the last week to create opportunity, additional spaces, so that that remaining 12 to 1,300 staff would have the opportunity to at least be offered an appointment. Now, going back to your question about data, we don't know if those additional folks may have been vaccinated in other parts of the state or in other states in general. We don't have the full understanding of that at the moment, but the overwhelming majority of those who had been identified as priority folks for the first wave had been covered with at least one dose. And we're continuing to work. I know the next phase of folks coming in would be March 15th, and we're again continuing to explore opportunities, potentially even as we move hypothetically to our next phase of folks being able to utilize some of the county apparatus to provide coverage to a number of staff that way.
Great, thank you. Just a couple more questions, if I may. The first one is probably for Dr. Gales, but obviously, Rich, feel free to weigh in. In the last couple of days, we've seen very promising data coming out on positivity rates dropping pretty dramatically in Montgomery County and other places. But at the same time, in the last day or so, we've also seen news coverage talking about how, well, we shouldn't let our guard down. This new data doesn't necessarily mean, that we're locked into any kind of long-term trend, and there may be, a forthcoming uptick in positivity rates and cases. So maybe you can talk a little bit about, what the new data that we've seen over the last few days and what we might see over the coming days and weeks means for our residents and businesses, and what activities we should or shouldn't be doing, and the general guidance. I mean, my assumption is the guidance doesn't change. We have to remain vigilant and do all the things that we've been doing. But what does the last few days of data mean for that? And can individuals who have been fully vaccinated and waited their necessary incubation period, should they be doing more things, allowed to go more places, or should they really just be continuing to do everything that we've been doing thus far in terms of safety protocols, masks, hand washing, distance, 6 feet, all that?
So the guidance is the same. Mask up, maintain physical distancing, limit your contact with other folks outside of your networks, limit group gatherings, continuing to wash your hand, and just being very careful, not participating in high-risk activities that have been identified that increase risk of transmission, particularly avoiding those situations in general, but certainly if you're in those situations, making sure that you wear your face covering and minimize your points of contact and maximize distance from others. And that goes for folks who haven't been vaccinated as well as those who have been vaccinated. And it's important for us to continue to stay vigilant within that. Now, the numbers have decreased, but there is a sense of a little bit of a plateau. It's, we've seen the sharp increase from where we were seeing 500, 600 cases a day. So now we're kind of hanging out in the low hundreds, like 110, 115. And I actually want to read a quote from the CDC director that came out this evening, that I think underscores our level of caution and why we're a little nervous and not rushing to reopen per se. And this is Dr. Walensky, who's the CDC director. Please hear me clearly. At this level of cases with variant spreading, we stand to completely lose the hard-earned ground we have gained. Dr. Rochelle Walensky said at the White House COVID-19 response team briefing, referencing emerging strains of the coronavirus that appear to be more transmissible, deadlier, and more resistant potentially to vaccines. I remain deeply concerned about a potential shift in the trajectory of the pandemic. So that means that, yes, we have seen improvements, and we are hopeful that the numbers continue to move in that direction, certainly as we have kids going back to school and those types of activities. But the reason why we're here is because we have restrictions and activities in place that are going to serve to drive those numbers down. And the concern is that if we reopen too quickly, thereby increasing, points of contact, increasing capacity, those kinds of things, that with these more contagious variants in place, that we could have, rapid spread of COVID to cause those numbers to go back up. And we certainly don't want to have a situation where we open too quickly, numbers go up, and then we have to take steps to go back and forth and close down. I will say that at least in the short term, if there would be a movement of certain activities to move forward, it's likely they would be done with some provisions. So for example, sporting activities, many of them back earlier, we didn't require that face coverings be worn. But the reality is if they were to restart in this setting right now, they'd be required, again, to minimize and mitigate transmission as much as possible. But I would say right now, we're continuing to monitor to see how the trends go. At least I can say this from a public health perspective. We're certainly looking at, if there are activities that can be done safely within the environment where we are right now. But I will say from a health perspective, I don't think any of us in the public health world are rushing to recommend reopening because of our concerns. We'd like to see more information about how the variant strains play out.
I appreciate that, Doctor. And I guess that's the very point of my question, was to make sure that members of the public who are tuned in don't misinterpret the data that they might be seeing or the reports that they might be seeing over the last recent few days about drop in cases as some sort of invitation to lower our guard. So thank you for that. And thank you for sharing the CDC director's quote. I don't know, Rich, you almost look like you had something to add. So I don't want to.
No, I was gonna,
words. Oh, okay.
I was gonna add, other than we got to keep wearing a mask, wash our distance, and wash our hands. And that's going to be with us for
a long time. Yeah. And then my final question, going back to the discussion that we started with, and I appreciate the attention that you both have paid to the importance of equity in the vaccination effort. Obviously, we as a municipality have been doing what we can on social media and other channels to do outreach to our communities and to make sure that disadvantaged communities in particular get the right information and the encouragement and the access. And I was thrilled to hear you talking about the CCACC as a vaccination site as well. Final question is, what else can we be doing as your municipal partner to help on this, aside from just continuing to spread the word and reach out to our communities?
Go ahead, Rich.
I would suggest, I don't know if people realize this, but the federal government, through the Federal Emergency Management Administration, has given states, including Maryland, a pre-authorization of money to spend on the vaccine campaign. The state passed on almost $20 million to us to help pay for everything from if there was more equipment we needed, to pay a surge of people to be vaccinators, to pay for campaigns to get people to come out and get vaccinated. well, that's why we had the meeting with Mayor Ashman and the colleagues from Rockville and Tacoma Park to talk about ways that we could enlist the 3 big municipalities in this effort. We could partner with you to hire people to go door to door in neighborhoods to get people to get vaccinated. We can partner with you on running ads, running Facebook ads, running other social media ads to do it. We're going to be starting radio commercials to try to get people out to get vaccinated. So being our partner with that would be a great aid. Thanks to the work of the president and at least the Democrats in the U.S. House of Representatives, the American Rescue Plan passed. And that plan will mean substantial additional money for all of our communities, including an estimated $10 million for Gaithersburg, $205 million for Montgomery County, $3.9 billion for the state of Maryland. So there are resources to be creative to get people out and get vaccinated to save lives and reopen our community.
Thank you both again.
Thanks, Ryan. Thanks, Rich. Lorianne, I wanted to give you a chance if you had anything.
Yes, I'll just be quick. Thank you both for coming here and for all the updates that you give during the weekly briefings to the municipal leaders in Montgomery County. I know you mentioned that we will be getting about, was it 40,000 doses this week? Did you say that we will be getting more doses this week?
The state will be getting 49,000 of the Johnson & Johnson. We anticipate we may get somewhere in the neighborhood of 1,500 to 1,600 of those.
To the health department.
The health department,
Okay.
on top of our weekly allotment of 4,500.
Okay.
I'm glad you asked that question because otherwise you would have been sorely disappointed when you didn't think a lot more.
Okay, and then I wanted to ask about the coordination with the private pharmacies because I have heard about the competition between the private pharmacies, and are we meeting with any of these corporations to help out at the ground level here?
So there are efforts to engage the pharmacies within that. And so part of the reason why that hasn't happened is in the early and mid phases of how this was rolled out, the states communicated directly to the pharmacies. We were not, as health departments, we were not included in any of those discussions, nor was it shared with us how many doses they were getting or what their requirements were within that. And we've continued to ask questions and ask for more information and transparency around that. Just in general to know where the doses are going, but also to ensure that how they're allocated and how they're distributed also follows some semblance of an equity framework. We have had one conversation with one of the companies who reached out to us. Their staff actually happens to be familiar with the county workings and participated in some of our activities. And so reached out to us to say, hi, we want to make sure what we're doing is consistent with the county framework. And I do know there's an effort, a joint effort from the CE office and the council to reach out to connect with some of those larger pharmacies to sit down and have conversation. And so we're hopeful that with that effort, we'll actually get more information from the state to be able to make those connections so we can talk about how their efforts, even though they're larger corporate entities, can be more specifically tuned into what we're doing here on a local level.
Today's guidance from the state did provide each one of the pharmacies at the grocery store. So the 2 Safeways, the 5 Giants in Montgomery County that are currently doing this, including, I believe, the Giant at Kentlands, they are going to be provided with an extra 100 doses a week, each one of them, to do targeted outreach within the community. So one way that you might work with that Kentlands Giant is to figure out how you can set up a program where maybe they will come out and go to a specific neighborhood, a specific independent living facility in the city to try to get that done, or with a naturally occurring retirement community. But they should have those additional doses there in order to help partner. And I don't know why the city wouldn't be a better partner for them. And I can just say too, for everyone who's listening, council member Sales, when we have our regular municipal briefings, you've made me nervous all night tonight because you are the very first person who always raises their hand is the person who facilitates that. I know Tanisha asks a lot of questions and represents the city well, but you have been an aggressive questioner and vocal advocate for the people of Gaithersburg in all of those meetings.
Thank you, thank you, thank you. Definitely, definitely. And so my final question for you guys was to ask about the contingency plan, if any, for an outbreak when schools reopen. And I know that the immediate plan would be to shut down, but is there an effort?
Not necessarily. So
Oh, okay, okay.
not necessarily. So there is I just want to use the term that I think I'm going to take with me forever after this year, to level set the expectations for everybody around outbreaks. So this is what happens is, and we've got experience. We had a team set up to assist the non-public schools for those that did go back. And we did experience a number of situations where there were cases involved in not necessarily outbreaks, but we had some situations. And so what happens is that if there is a report of a case, it's reported to the health department, to the disease control team. And what happens next is it's the contact tracing process that finds out more information and determines what's the scope of what's the index case. Index case being who was the case that tested positive, who were they around, when were they in the school, who were they with, what type of interactions did they have, was there face coverings involved, all of those kind of things. And based upon that fact-finding exercise, or that's what we would call contact tracing investigation, then it would be determined who is considered to be a close contact or at risk of exposure. Depending upon the level and the type of exposure, that would then determine the guidance that would be given, whether it would be, you got to close a classroom, you've got to close the school, you've got to close a bus route. It will all be dependent upon an individual situation. Now, we've had situations where, based upon the exposure, we have had to recommend that a school close down for a period of time, for a quarantine period. Other situations where it's been, actually, we've not had to close, or we've had to recommend a classroom quarantine until we got further information. So it just entirely depends on the level of exposure in the individual case. But we wouldn't reflexively shut everything down if someone tested positive. It would depend on the case.
All right. Well, I'm glad we have both of you on the job, and I'm really confident about the continued rollout and dissemination of this vaccination. So thank you.
Thank you.
Thank you.
Thanks, Lorianne. Before we end this, Ryan had brought up the question about what can we do, how can we be a partner, and I think Tanisha wanted to say a few words about that.
Thanks, Mayor Ashman. I want to also thank Dr. Gales and Mr. Madaleno for being here this evening. In addition to the mayor's meeting with Gaithersburg, Tacoma Park, and Rockville, the city managers of those cities also had an opportunity to meet with Rich and Dr. Gales and Earl Stoddard to talk about several issues that came up this evening from the vaccination process for municipal employees. Not so much the timeline, because as we've heard, it will all depend on when supply is available, but the process and making sure that we're communicating well there. And we spent a lot of time talking about our most vulnerable residents and how we can be a better partner to the county to help connect. And at that specific time, when we had the discussion, we were concerned about those seniors who live in independent living, who would not have been picked up by those that are in, congregate care, nursing facilities, assisted living. And we in Gaithersburg especially have concentrated areas of low-income seniors living in apartments where we could connect them to be sure that they got registered. And so we had a great all-hands meeting with our staff to be able to mobilize them to stop whatever they were doing, to be sure we connected to the property managers, folks on the ground that could help connect the county to them. And so I want to thank I want to thank the county for being such a great partner with that. And that apparatus can be, scaled up. So we certainly can help you spend that $20 million to be sure that we get to Gaithersburg residents. And then also want to mention that Britta and some of her staff are helping to lead a county task force also focused on our most vulnerable residents throughout the county. And so there is great Gaithersburg representation as we think about how to reach those who aren't connected in these ways digitally or otherwise, whether there be language barriers or other types of barriers in the way. And we've got great infrastructure here in our community that our staff has worked with our nonprofit partners to construct over the years. We've used that to get food out to people. We've used it to get the word out about testing, and now we want to activate it even more effectively to get vaccines to those who might not otherwise get registered or have other issues. So I just wanted to mention that, and thank you both again for all of your time weekly, bi-weekly on the calls and being with us here tonight. Now turn it back over to Jed.
So if I may, when Tanisha mentioned the $20 million, I think you were referencing the $20 million that the county executive and council put forward for rental assistance.
No, actually, I know we're having a separate meeting about that, Rich. I'm talking about the FEMA $20 million to help with vaccine.
Okay, thank you. Okay.
Yep.
And you should all know that Tanisha's already made an amazing impact on, got us together and said, I've been in places where there's a much better relationship from the city and county, and I demand the same relationship here. And we've already started to put together meetings to get that done.
That's music to our ears. I saw Neil's hand go up. Go ahead, Neil.
So I just wanted to follow up on Rich's comment about the Kentlands Giant, which happens to be my home turf here. It's about 2 blocks from my home. One thing I've noticed is that when there are people getting the vaccine at the Kentlands Giant, there's really no space around the pharmacy counter. There's minimal amount of space for it. So if the number of doses that they get access to is increased, I don't know what they're going to do. So I think the suggestion of having the city partner with that giant to do something to make those vaccines more available. I mean, if nothing else, they're going to be space constrained in how many vaccines that they can actually administer. I'm not sure how motivated they are, because I know it's a good draw to get people into the store, but they're a pretty busy supermarket, so they probably would be open to some suggestion. But I think there's a great opportunity there, and I'm glad that, Rich, that you brought it up.
All right. And with that, we won't keep you guys any longer. We appreciate all of your time tonight and everything that you've been doing for the county, for our community. And next time, may we be meeting in person, and may we have an opportunity to take you guys out for a beer afterwards and toast to the good work that you guys have been doing all along. We're in your debt.
We look forward to celebrating VC Day with you all as we. So,
Thank you so much,
and on behalf,
great questions.
On behalf of the county executive and the county council, thank you for giving us that opportunity and for your continued support.
Excellent. You guys have a great night. We are going to move forward in our agenda to public comments. And this is a time where the mayor and council like to hear from anybody who'd like to speak on any topic, because we have no public hearing. So there's no restrictions, any city related topic. We ask that you keep your comments to no more than 3 minutes. State your name and address or neighborhood for the record. Tech team, do you have the video ready with the instructions of how everyone can raise their hand?
Got it.
Good evening. If you've connected to the meeting tonight via Zoom and you're on a desktop or a laptop and you wish to make a public comment, we can't currently see or hear you. What you need to do, please, is wiggle your mouse around and look towards the bottom center of your screen. You should see a raise hand button. Go ahead and click on that now for us, please. Alternatively, if you've connected in via telephone, you can press *9.
Thank you, tech team. I thought I saw a hand for a second, but I'm not seeing a hand anymore. Do we have anyone who wishes to speak from the public tonight? Okay, I see one hand. Tech team, can you bring up Jane Howard, please? And Jane, just state your name, address, or neighborhood and go right ahead. It looks like you're on mute, so just unmute yourself, Jane. There you go.
Gaithersburg near Professional Drive. I have several people, friends who were vaccinated at Orchard, another at Gaithersburg High School. I myself went to Six Flags.
Jane, I need you to speak directly like into the microphone because you're coming in and out for us.
Okay. I have a lot of friends who were vaccinated at different places, and I went to Six Flags. But what is this
Jane, can you hear me? We really can't hear you. Can you just test it one more time? Just try to say something. All right, yeah, for whatever reason, the audio is not working. What I want to suggest to you, Jane, is that you send me an email or send an email to cityhall@gaithersburgmd.gov with the information you were going to testify to. And I apologize. We just could not hear what you were saying. Also, you can, if you prefer, you can send the email directly to me, judd.ashman@gaithersburgmd.gov. Do we have any other speakers this evening? Not seeing any. Okay. Well, then we are going to move forward in the agenda. And Jane, please do send that email. We're going to move forward from the mayor and city council. We're going to start with Councilmember Wu.
Thanks, Mr. Mayor, for letting me go first. I am just going to reflect on all the good information that we just received. And so I have no further comment.
Okay. Thank you, Rob. We'll go to Neil Harris.
So I'm going to keep this very brief as well. I was able to go to Baltimore to Johns Hopkins, where I had seen a doctor before. And I think I mentioned this at a previous meeting after I had my first dose, but I had my second last week on Thursday. And aside from a little bit of a soreness in my shoulder where the injection was the next day, I had no side effects. I know my wife was down with flu-like symptoms the next day, but I had no issues at all. So I don't want to belabor the point, but get the vaccine. It's certainly, even if you get some side effects the next day, it's going to be a lot better than actually getting sick from COVID. So, and a lot of people like me didn't get side effects at all. So please sign yourself up when you can. I'll leave it at that. Thank you.
Thank you, Neil. We'll go to Ryan.
Thank you, Mayor. Just briefly, last week, number of important meetings with the Maryland Municipal League. On Thursday evening, we had the quarterly Board of Directors meeting virtually for the Maryland Municipal League. Not too much to report there other than that we decided that since we had to cancel the fall conference in College Park in 2020, that we will have College Park host the fall conference. I believe it's in 2023, which is the next unclaimed year where we needed a venue, and we're looking forward to heading back to College Park in 2023 to be with them as our hosts. On Friday, the Maryland Municipal League also hosted one of its monthly virtual town halls, this time with the Senate President, Bill Ferguson, and Speaker of the House of Delegates, Adrian Jones. A great opportunity to ask some important questions about the various legislation initiatives, including things like police reform and other big funding measures that are being considered, as well as some environmental measures that are being considered right now in Annapolis as they meet in their session. Otherwise, that's all I've got this evening, except to say happy Women's History Month, and looking forward to marking Women's History Month in March.
Thank you, Ryan. We will go to Lorianne.
Speaking of Women's History Month, thank you, Ryan, for sharing about Women's History Month kicking off today. And International Women's Day is going to be on March 8th. A few more highlights. I too will keep it brief because we did get a lot of really good information from our speakers earlier about the COVID-19 updates. Next week, we'll be heading to the National League of Cities for our virtual congressional conference where we will be meeting with leaders on the Hill. And I'm really glad we had this briefing with the county partners to talk about the funding that they are expecting for reimbursement and for how we're going to allocate this vaccination. So it's perfect timing as we head to the conference. I also attended a few events last week. I attended the Is Everyone Really Equal? Creation of Resistance virtual workshop. It was hosted by the town of Chevy Chase's Racial Justice Special Committee, and it was their kickoff event of their Racial Justice Speaker and Event Series. Really engaging conversation with their community appointed members and members of the general public were in attendance, and an excellent facilitator from Montgomery County Public Schools. So this was just the first event, but it's a really interesting model, and they actually worked with the National League of Cities to get the template for implementing their best practices as they make recommendations to the Chevy Chase Town Council. So you can learn more about that on their website. And lastly, as we all know, the pandemic has had devastating effects, not just on health and the public health, but also on social issues as well, to include safety net services like housing and food insecurity. And so I am working with a few community organizations, including Cross Community Church, the Brothers, the 480 Club, and Cool and Dope nonprofit, to host a Feeding Gaithersburg event this Saturday at Gaithersburg High School. So special thanks to Carrie Dimmick, principal at Gaithersburg, and our very own chief of police for working with me to assist with traffic calming during the event. And if you want to learn more, just sign up at bit.ly/Feeding Gaithersburg. And that's all I have for this evening. Thank you.
Thank you, Lori Ann. I will move on to Mike.
Thank you, Mayor, and thank you, everybody. I will echo the comments of my colleagues, and again thank Mr. Madalino and Dr. Gales for their presentation and information. I guess the most important lesson to be had from that presentation is we shouldn't let our guard down. We still have a pandemic going on, so wash your hands, keep your social distance appropriately, avoid crowds, especially indoors, and mask up. If you haven't received your flu vaccination for the season, advise you to do that as well, because we still have to deal with other illnesses and diseases that are seasonal. So get your flu vaccination in addition to trying to being persistent to get your COVID vaccination. It's the most important thing. A reminder that the House of Representatives passed the American Rescue Plan Act of 2021. The Senate will be discussing it. That bill includes $350 billion in emergency relief for states, local governments, tribes and territories, and other funding to address housing, education, food and nutrition, unemployment assistance, vaccines, testing, and FEMA assistance. So if you haven't reached out to your elected members in the Senate, or in the House of Representatives, please do so and let them know. We heard a little bit about that, that aid that would come to Gaithersburg and cities like us. We heard that from Mr. Madalino. And also it's important that there's a lot of aid to reopening schools and making sure that Americans are vaccinated for COVID. So Black History Month ended yesterday. Women's History Month begins today, but I would remind everybody that every day something important in Black history happened and something important in women's history happened. That's every day of the year, 365 days a year. So and keep that in mind as you spend your week educating yourself, keeping yourselves healthy, and taking care of your friends, neighbors, and family. That's it for me. Thank you.
Thank you, Mike. So I have 3 items. I'm sorry, it's gonna take a little time. The first one is in our last meeting, we discussed my testifying on behalf of the city on March 4th, which is Thursday, at the public hearing for the Craig Rice, Sidney Katz bill on school resource officers. We had a majority of support, but everyone wanted to see what Nancy Navarro, who had put out a press release or a public letter about it, and see what her intentions were. And since then, Jess got us a copy of the letter, and although it was unclear exactly what Councilmember Navarro intended to do, it looked like it was going to be an amendment for some sort of middle ground. And so as the public hearing comes up, my feeling is, rather than get too specific about which bill this is or whatever, that the 2 main points of the testimony are really just about the city's position. Number one, the first main point being we support all efforts to enhance safety at our schools and to support our and support for students' mental health, and that we support the SRO program in our schools, not only for the purpose of school security and or law enforcement, but also because of the opportunities for youth mentorship and for very much needed positive interactions, trust, and bridge building between police departments and young people in our community. So I wanted to just put this out there and make sure, or just see if we still have a majority in favor of delivering this testimony on behalf of the city. And so I wanted to put it out there if anybody wants to comment. Lori Ann, please.
Well, I've already expressed my concern about weighing in on this issue and hearing the 2 points that you've outlined. My concern is with having armed officers in places that are supposed to be conducive to education, and not necessarily militarizing our students' learning environments. And so while I agree that security is definitely needed, I don't believe that Montgomery County Public Schools needs armed officers. So I don't agree with supporting this testimony. And I just want that to be clear on record. I support the first point, but I don't agree that we need armed officers in our schools. So.
Thank you. Fair point. Ryan, please.
I'll say that I think generally, Mr. Mayor, your approach makes sense, except that I would add the caveat that we ought to explicitly include in our testimony a reference to enhancements or reforms to the SRO program that should be explored. And I actually think that the Rice-Katz bill proposed to do that. I know we're now talking more in terms than for or against any particular bill. That's my understanding of your proposed approach, and I'm fine with that. But I think we ought to include in there support for reforms and enhancements that would be recommended through, whatever formal process the county undertakes. What an SRO looks like today or yesterday may be different than what an SRO looks like in a year. It just sort of depends on, what sort of improvements to the program are warranted, in light of the research and the work that's done by the county. So I think we ought to specifically say that we support that effort as part of our testimony.
Okay, fair point. Mike, go ahead.
Yeah, I basically, what Ryan just said was what I was going to mention. I think it's important. My position hasn't changed. I oppose the total elimination of the SRO program that the opposing bill proposes. I think we need to look at the benefits and also consider the risks, which is what I think the Katz and Rice bill has considered in terms of proposing a significant amount of training and preparation and orientation for those who would serve as an SRO. And I think that's basically where I stand. Same position as before.
Okay, thanks, Mike.
I'm sorry, in support of your statement, right?
Thank you. Rob or Neil, anybody you guys want to weigh in? One way or another? Okay, I saw Neil's hand go fully up first and then Rob. Go ahead, Neil.
All right, well, I'll keep it very brief. I support your statement and position. I don't like the idea of guns in schools, but all the feedback I've had from talking to principals and talking to the city of Gaithersburg High School's SRO lead me to believe that the program is much more positive than negative in terms of providing mentoring to students who are in need of a course correction.
Okay, thanks, Neil. Rob.
Agree, Mr. Mayor. In the balance between the risks and rewards, I think the SRO program offers benefits to our community. I think it's quintessential community-based policing practices. I do weigh favorably Ryan's comments about enhancements to the program. And if we want to specifically highlight those, I'm in favor of that as well.
Okay. All right. I thank you guys. I want to move on to the second of my three items, and that is ever since we implemented our stormwater fee, I'm going to talk about the stormwater fee, just a little background, and then talk about how it's relevant now. The fairgrounds is one of our larger property owners, and they have, because the fee is allocated equitably based on how much impervious surface you have, and they have a lot of impervious surface, their stormwater bill is high, and they knew from the beginning it was going to be, and they were resistant to it, but we allocated the fee as fairly as we could. I can't think of a more fair way to do it than to all property owners and based on how much impervious surface you actually have. Anyway, as we all know, there was no fair last year. So that's their major revenue source is the fair, and it's unclear if there's going to be a fair this year. So they went to Senator Nancy King and asked Nancy to sponsor a local bill that would essentially exempt them from our stormwater fee. Now, this is problematic for us. We understand their position. This is problematic for us because if the state were to come in, and I'll just, even as a matter of further background, the whole stormwater program is a result of an unfunded mandate from the state. It's well-intentioned. It's a good cause to clean up our waterways and improve the Chesapeake Bay, but it came with no money. And this is a very expensive set of endeavors. And so for the state to come in now and say, well, we gave you this unfunded mandate, and now we're saying, we're trying to exempt one of your main property owners and payers into the fee. That's problematic, and what it would force us to do is reallocate the fees and raise the fees for everybody else, including nonprofits, including the city of Gaithersburg itself, because we actually assess the fee on our own properties. So I was not aware that Nancy had introduced this bill until I got a call from Senator Kagan, essentially saying, well, you know, how does the city of Gaithersburg want me to represent them on this bill? And then we got into it. But I just want everyone to know that since that time, which was just after the last meeting, staff and I have been busy lobbying and trying and making our case for either the killing this bill, either a no vote on this bill or amending it in one of two ways. Either they would put a sunset on this exemption. You know, we do understand the fairgrounds has had this damage to their revenue from not having a fair last year and maybe not having one this year. We'll see. So if there was going to be a sunset after 2 years to sort of recoup the 2 years that they're having to make this payment even without the revenue, okay, we can understand that. Or the state could just exempt us as a city from being responsible for addressing the stormwater from that property. One of those two things could make it palatable to us to some degree. And I wrote a letter to the delegation to that effect, and it's in our package if anybody wants to see it. So I just wanted to put that on your radar screen. We are working on that. I feel pretty confident that we're going to get some good outcome, but we'll see. And then my last item is I wanted to give my first sort of full-throated Gaithersburg Book Festival promotion for this year. We are going virtual, which is, you know, it's crushed my soul in many ways, but we're going to make the best of it. We have an incredible lineup of authors. I just want to give you a few of them. We're probably going to have somewhere close to 100 authors, and we're going to have a ton of programs, and it's going to be a lot more than what we did last year because we've had more time to plan for it. But just a couple of highlights. Ishmael Bia, who is a Sierra Leonean author who he had this great memoir about 10 years ago called A Long Way Gone. It told the story of how when he was a teenager, there was the civil war in Sierra Leone, and both the rebels and the National Army came through and basically decimated his town and killed most of the people and took him as a young teenager. He ended up in the National Army, you know, conscripted, and it's just a harrowing, amazing story. He's not talking about that book, although I'm sure he'll reference it. He's talking about his next book, but it's a real honor. It was a huge book. A lot of poetry this year. One poet she's locally based and she's pretty big. Her name's Sandra Beasley. We have Janine Cummins, who was going to be in person with us last March to talk about American Dirt. And even though I'd much rather do an in-person event with her, you know, American Dirt ended up being one of the top 10 best-selling novels of all of 2020. We're gonna just do it virtually because we can't wait that much longer. But she's gonna be in conversation with NPR's Maureen Corrigan, so that should be pretty cool. Cory Doctorow, for people who like sci-fi. We usually haven't had much of a sci-fi lineup because there's a big sci-fi event that coincides with that same weekend. But Cory Doctorow is pretty big, and we're really psyched about getting him. Science, Dr. Michio Kaku, who is this amazing, for anybody who watches the Discovery Science universe shows, that sort of stuff, enjoys all the stuff about the planet and theoretical physics. This guy's on all those shows all the time. He's a professor at NYU. He's a theoretical physicist. He's one of those geniuses that could just break down Einstein or Newton or whoever and into terms we could all understand. Just a brilliant, brilliant guy. For children's authors, we have John Klassen, who we've been trying to get forever. He's perhaps the most popular and beloved illustrator of children's books in the whole world. I mean, this guy, he's amazing. He's won a couple of different Caldecott medals. He's great. Carol Lindstrom, who is a children's book author, and her book actually did win the Caldecott this year. It's called We Are Water Protectors. And she is Native American, and that book is really featuring the Native American perspective. Carlos Lozada, who is the nonfiction critic for the Washington Post, just won the Pulitzer Prize last year. He's going to be here. Susan Page, you guys remember Susan Page? She's been at our festival before. She moderated the vice presidential debate with Pence and Kamala Harris. She's got a book about Nancy Pelosi. She's going to be talking about that, and she's going to be paired with Washington Post columnist Karen Tumulty, who has a book about Nancy Reagan. And I'm going to stop there. But I could go on. You guys just got to trust me. I could go on. If you want to find out more, go to GaithersburgBookFestival.org and follow us on social and subscribe to the newsletter, because this is going to be amazing and we want everybody with us virtually. And with that, let me see.
Mayor, you didn't give us the dates of when this starts.
You know, that's a fantastic point. We are going to be running virtual programming starting on May 1st, which is Saturday, May 1st, and we're going to be doing it really for 4 weeks, I think, in May. Mostly on weekdays this time as opposed to weekends. But we don't have the schedule, and we know May 1st for sure. We don't have the schedule done quite yet. So more details will be coming. This is not the last time you guys will have to suffer through one of my promos. And last, I will say next week, join us. We have our work session. It will be on the draft Lake Forest Mall master plan. So that's a big topic. And however you're joining us now, you can join us then. You can be on the Zoom if you like. Sign up at gaithersburgmd.gov/virtual, and we will move to From the City Manager.
Thank you, Mayor. It's 9:30. You all have not got to your business yet for the evening. So I'll just say one thing that I think you would be interested in. You might recall the AT&T cell tower that was proposed off of Great Seneca Highway. A bit of a long process there that we've gone through with them and this cell tower piece, including the last action you took was last summer, where you directed staff to investigate with AT&T the actual needs for that new tower and alternative locations, and to do an RFP that perhaps they might pay for some portion of. We did conduct the RFP, the evaluation. We selected someone who we thought could do the work for us, and we just heard late last week from AT&T that at this time they have decided to suspend their plans to pursue the site. So we will be updating the project page on the city's website with that information. We know there was a lot of neighborhood concern and interest in that particular issue, and so we'll make sure that we get the webpage updated, but I want to make sure you all got that information as well, and I'll just leave it there for this evening. Thank you.
Thank you, Tanisha. You did pick something that I'm sure everybody's interested in. Well done there. We'll move on to economic development update. Tech team, can you bring up Tom Lonergan, please? Welcome, Tom.
Thank you, Mr. Mayor. I got 2 items this evening. I'll try to be brief. Building on a month of strong Paycheck Protection Program results, the Biden-Harris administration and the Small Business Administration are now taking steps intended to further promote equitable relief for America's mom and pop businesses. These steps are intended to further the administration's commitment to racial and gender equity, reaching low and moderate income, rural, urban, and other underserved communities. The SBA has established a 14-day exclusive PPP loan application for businesses and nonprofits with fewer than 20 employees, and that ends pretty soon on March 9th at 5 p.m. Economic development staff, of course, will be getting the word out to as many as possible. A couple of points about it. This adjustment will now allow sole proprietors, independent contractors, and self-employed individuals to receive more financial support by revising the PPP funding formula. There will be an elimination of an exclusionary restriction on access for small business owners with prior non-financial fraud felony convictions, elimination of PPP access restrictions on small business owners who have struggled to make federal student loan payments, and ensuring access for non-citizen small business owners who are lawfully residing in the U.S. by clarifying that they may use an individual taxpayer identification number to apply for the PPP. More information, of course, can be found at the SBA's website about these changes to the program. Secondly, and finally, I did want to mention that I have haunted Tanisha over these past few days with tales of ghost kitchens popping up around Gaithersburg, but I did want to quickly acknowledge their increased presence here in the city. As you know, ghost kitchens are pop-up food concepts in which restaurants cook meals in a brick and mortar kitchen for pickup and delivery, and they have become an increasingly popular business model during the pandemic era. Michael Alexander, who owns Boca Botanas at the Festival Shopping Center on Muddy Branch, plans to launch 3 ghost kitchens this month that will operate out of the restaurant's kitchen, which was nicely highlighted in an article in Bethesda Beat earlier today. Guy Fieri's Flavortown concept has certainly garnered the most press for his new outpost at Buca in the Kentlands. But in fact, there are at least 3 other chains operating ghost kitchens out of the Buca de Beppo location, Mr. Beast Burgers, PZA Kitchen, and Tiger Bites. And while the onset of COVID certainly accelerated their growth, the development of these virtual ghost kitchens was well underway well before the pandemic. From DoorDash to delivery trucks, consumers had been changing the way they eat, and operators have been looking for ways to reduce levels of required capital investment. In short, Mr. Mayor, I wouldn't expect these ghosts to be purged anytime soon. That's it.
All right. Thank you, Tom. A poltergeist themed economic development update. Okay. Tech team, can you bring up, please, Tony Berger? And we're going to move on to ordinances, resolutions, and regulations, and we're going to talk about the pedestrian bridge. Welcome, Tony.
Thank you, Judd. Good evening to you and to the council. This item begins on page 44 of your packet. Tonight, I have a resolution for your consideration that allows the greatest city in the world to move forward with the design of a pedestrian bridge over Great Seneca Highway and its intersection with Kentlands Boulevard to the west and Orchard Ridge Drive to the east. Back in October of 2017, the city began working with A. Morton Thomas and Associates and developed the base concept for the project, which is shared on page 48 of the packet. Just about 1 year ago, the city entered into a funding agreement with AstraZeneca that provides $4 million for the design and construction of this project. Last fall, the Engineering Services Division used the previously developed concept as the basis for soliciting proposals for design of the pedestrian structure. In addition to simply designing a bridge, the solicitation also requested consideration for public art be included in the design process. Included in the agenda on page 45 is a listing of the proposals received, and they're listed alphabetically. Our review of the proposals was carried out in 2 phases. First, the 5 proposals were reviewed by a technical review committee and shortlisted to a group of 3. The shortlisted group was then invited to participate in an oral presentation to an executive selection committee that had representation from the city manager's office, Parks, Recreation, and Culture Division, and a representative from AstraZeneca. The collective results of the technical review, along with the individual results of the executive selection committee, demonstrated a clear choice in EXP US Services Incorporated. I've included a rendering of the bridge taken from EXP's proposal on page 53 of the packet. EXP is teaming with Cliff Garton Studio, AB Consultants, Flora Teeter, and Bowman Consulting Group to endeavor, in their words, to provide an optimized design of the pedestrian bridge that creates an inviting and attractive, and importantly, a safe connection. Some examples of the consideration for public art presented in the proposal included stamped concrete, a variety of lighting effects, as well as expandable options such as pressed metal applications and even standalone sculptures. Funding for this project is available in the Capital Improvement Program budget, and as the duly appointed selection manager, which I'm not exactly sure if that's a volunteer position or a voluntold position, it is my pleasure to recommend the city enter into a contract with EXP US Services for design services for the pedestrian bridge over the Great Seneca Highway in an amount not to exceed $503,600. And with that, I'd be happy to answer questions at this time.
Thank you, Tony. So just to clarify, this contract or this funding could include artistic public art. It could include fancy, nice lighting, the whole thing.
It can include that. Like I said, the proposals listed quite an array of different possibilities, just depending on how they move through the actual design process. What they come up with for the structure itself will flesh out what the public art is included as the project, but it also does certainly lend itself to future additions as well.
And will that design come back to us?
Absolutely. You'll see the first propositions come back at the 30% design
Got it.
phase.
Got it. Thank you. Questions, comments? Mike.
Sorry, I keep losing the mute button. I guess it's probably important to remind the public that this is just more or less the down payment on beginning the construction. And so perhaps, Tony, you can tell us what the entire project is slated for, and where some funds are coming from.
Well, like I said, we've entered into an agreement with AstraZeneca, so $4 million is being provided from that agreement. Right now, the project is, I mean, it's very preliminary, but the project has an estimated construction cost of about $3.6 million, which would bring us into the $4.1 million range. And there's going to be some a minor amount of right-of-way acquisition associated with that.
That's great. Thanks. I think that's pretty clear to the public then, that this is part of the process. We've been waiting a long time for this to go forward. So what do we know about the experience of the EXP? Do we know of other projects, similar projects they've done in the area?
Yes, they have given us quite a nice listing of them. I'd be happy to share that with you. I don't have the list in front of me right now. EXP itself is a newish company, but the team that's on the company has quite a nice resume of experience, and I feel very comfortable with this team.
Okay, thanks.
We'll go to Neil.
So Tony, I'm really very happy to see this come before us. The last time we saw some discussion of this bridge project, it was really focusing on engineering, and a lot of the nearby community members were concerned over the utilitarian nature of the drawings, which were just there to show how this bridge would be put together and held up. So the fact that we're now working on the aesthetic side pleases me, and I'm sure will please them greatly. I look forward very much to seeing what the vendor comes up with, and look forward to a safe trip across Great Seneca Highway when it's ready. Thank you.
Thanks, Neil. Do we have anyone else, or would someone like to move the resolution? Lorianne?
Mayor, I'd like to move the resolution for the.
Okay. Oh, sorry, go ahead.
No, I'd like to move the resolution.
Perfect. Okay, Neil?
Sorry, I got excited. I would like to second the resolution.
Okay, great. So I'll call the roll. All in favor say aye. Any opposed say nay. Councilmember Spiegel?
Aye.
Councilmember Sesma?
Aye.
Councilmember Sales?
Aye.
Councilmember Wu?
Aye.
And Councilmember Harris?
Aye.
All right. Thank you very much. Carries unanimously. Appreciate it, Tony.
Thank you.
Tech team, if we can bring up Kirk Evie, that would be great. We're going to move on to discussion of our zoning text amendment. Welcome, Kirk.
Thank you. Good evening, Mayor and City Council. Tonight is staff is seeking sponsorship of a revised version of a text amendment to the zoning ordinance, chapter 24, to define cremation services and indicate in which zones the uses will be permitted or allowed as conditional use. And if we could actually start the slideshow, that would be great, which starts on packet page 64. Okay, thank you. Forgot about that. Okay, and we're ready for the next slide, actually. Thank you. So this text amendment was initially presented to the council at its February 16th meeting. And following the council's discussion, staff was asked to revise the text amendment to further restrict where cremation services will be allowed as conditional use and where they will be prohibited. Next slide. So the revised text amendment prohibits cremation services on property that is within 500 feet of property that contains a residential use. And so that's a measurement from property line to property line. It also allows funeral homes to offer cremation services only as a conditional use in the CP, C2, CBD, CD, I1, I3, and MXD zones, where it is not otherwise prohibited due to being within 500 feet of a residential use. It allows standalone cremation services only as a conditional use and only in the I1 and I3 zones, where it is not otherwise prohibited due to being within 500 feet of a residential use. And cremation services will no longer be allowed by right in any zone, even as an accessory use to an existing funeral home. Next slide, please. Next slide, please. Maybe I'm behind one. Apologize. Okay. Conditional uses are defined in the code and require the issuance of a special permit by the city council. The permit requires a separate application that is subject to a public hearing process as detailed on this slide. Next slide, please. So conditional use permits require 5 findings, which in summary must show that the use will not be incompatible or inharmonious with the general character of the neighborhood, will not be detrimental to the use, peaceful enjoyment, economic value, and development of surrounding properties, will not cause objectionable noise, vibrations, fumes, odors, dust, glare, chemical contamination, or physical activity, will not adversely affect the health or safety of persons residing, working, or traveling in the neighborhood, and will not constitute a violation of any provision of the city code or other applicable law or regulation. And that might include something like a state, federal, or city law regarding emissions or noise. And quick slide here. And of course, part of the permit process includes this joint public hearing, planning commission recommendation, mayor and city council final action. And I think I'm actually one slide ahead of everyone. I apologize for that. So can we go ahead and go to the next slide? Okay, okay. I apologize. I have a little bit different slide set than what was shown in the package. I apologize for not looking at that earlier. So this is what I just went over, which is the findings required for conditional use. So that was the first one, which in summary again is that the use should not be incompatible or inharmonious with the general character of the neighborhood. There's a little more language there. This is the actual language from the code. And then we go to the next slide. And these are the other 4 findings that I talked about earlier. And again, these are taken straight from the code. So next slide, please. Okay, so this is a map that shows the areas of the city zoned C2, CBD, CD, I1, I3, and MXD that are within 500 feet of a residential use. So I'm going to walk you through the colors on this map. So the dark blue areas are where the I1 and I3 zones are. And of course, those zones would allow cremation services as a conditional use, either as a standalone or as part of a funeral home. And the light blue areas are the areas where the C2, CBD, CD, and MXD zones would allow cremation services as a conditional use when it's part of a funeral home. No. And then the red areas are where cremation services are prohibited in the C2, CBD, CD, I1, I2, and MXD zones because they are within 500 feet of a property that contains a residential use. And then the gray areas are other zoning districts where funeral homes and thus cremation services are actually currently prohibited. And staff notes that the draft text amendment also discusses the CP and RO zones, but currently no land in the city is zoned CP or RO, so those are not shown on this map, obviously. And also of note, the 2 funeral homes that are in the city, one is called Thibodeau Mortuary, and that's in Old Town, and the other one is Duvall Funeral Home, and that's on Frederick Avenue. Both of those funeral homes are located within the red prohibited area shown on this map. And next slide, please. So this is a similar map showing the areas of the city zone C2, CBD, CD, I1, I3, and MXD, except that these are the areas that are within 250 feet of a residential use. So the color scheme is the same as the one that you saw on the 500-foot map previously, except of course the red areas now are showing the areas of that are prohibited use in those zones where it's within 250 feet of a residential use. Staff notes that on this map, both of the existing funeral homes are still within the prohibited red area on the map. So next slide, please. So similar to the last two maps, this is a map showing areas of the city in those zones I mentioned. And this is then within 100 feet of a residential use. So the color scheme again is the same, except the red is the prohibited areas that are within 100 feet of the previous areas. And if you were paying a little bit of attention, you should have seen from the 500-foot map to the 250-foot to the 100-foot map, you should see there's a little more blue on each map as we went through. So this is the map that has the most blue and the least red, whereas the 500-foot map was the one that had the most red and the least blue areas. So on this map, staff notes the Duvall Funeral Home is within the red prohibited area shown on the map. Thibodeau Mortuary, which is again in Old Town, is in the light blue area, so where cremation services would be allowed as a conditional use if they are part of a funeral home. Staff would also like to caution that all of these maps were created using residential areas that exist as of today. We did make certain adjustments for Crown and the Chase at Quince Orchard because there's a lot of residential that is not constructed over there, but we know it's basically going to be constructed. So we are showing that all of that area would be red, or treating those as if they were constructed, I should say. So in the future, if residential uses were to be added or removed from any property in the city, obviously that could affect where a cremation service would be prohibited or allowed as a conditional use. And so these maps will look different potentially in the future. So I just wanted to kind of point that out. And I think we're ready for the next slide. And so this last map is just sort of to clarify based on the 500-foot map really, but showing that all of the blue areas that under all three of those distance maps you just saw, these are the properties that would allow a cremation service either as standalone, which is the dark blue, or as part of a funeral home, which is the light blue. So this is just sort of a simplified map just to show those areas where it would be allowed. And I think we're ready for the last slide, which is just to go to the next steps. So staff is available to answer questions about the draft text amendment. And should the council choose to sponsor the text amendment, the staff does recommend that the joint public hearing be held on May 3rd, 2021. And with that, I'll take any questions you may have.
All right, thank you, Kurt. So what's before us now is a motion, would be a motion to sponsor the text amendment and take us to public hearing. Questions, comments? I see Mike's hand. Go right ahead, Mike.
Yes, Kirk, thank you very much for the presentation. This is much more clear than the previous one, I think, and much easier for the public to understand as well as the council. I think last time I asked for a better definition of what the words adjacent, abutting, and confronting were. I don't think that it's necessary now that we need those definitions so clearly defined, as we're now talking about approximate distance of the from the property line to property line of the funeral home and potential crematorium services related to residential uses. So I'm prepared to move to sponsor this.
Rob Wu.
Thanks, Mayor, and thank you, gentlemen, for the presentation. I guess my one question would be a Lynn question. Is that the least restrictive of the three options would be the 500-foot setback? Or that's the most restrictive?
That would be the most restrictive,
Okay.
yes.
And so if we were to consider other distances, the 250 or 100 based on public comments, we would want to go with the 500-foot distance because that would allow us to consider the 250-foot and the 100-foot distances?
That's correct. At sponsorship, if you want to subsequently consider a lesser footage requirement, you should introduce as proposed with the 500-foot restriction.
Okay, thank you.
All right, well, Mike put a motion on the table, right? That was a motion, right, Mike?
I should clarify that with, and say the sponsor it with the 500-foot restriction.
But, okay, so there is a motion on the table. I saw Lori Ann's hand go up.
Well, I was going to second the motion.
Okay, so we have a motion and a second. Raise your hand if there's any more discussion before we vote to introduce or sponsor. Not seeing any. Okay, I'm going to call the roll. All in favor say aye. Any opposed say nay. Councilmember Spiegel.
Aye.
Councilmember Sesma.
Aye.
Councilmember Sales.
Aye.
Councilmember Wu.
Aye.
And Councilmember Harris.
Aye.
All right, carries 5-0. Consider it sponsored. Thank you all very much.
Thank you.
Next, we have from the city attorney and also tech team, if you could bring up Dennis Enslinger, because I know he has an item for us too. Lynn, do you have anything for us?
Yeah, I don't have anything additional this evening.
Okay. Well, then we'll wait for Dennis because I know he has something he wanted to add. Welcome, Dennis.
Good. That was good timing. I got back just in time to introduce the item. So good evening, Mayor and City Council members. I just wanted to bring to your attention and the public's attention that the city has approved some of its first small cell facilities within the city. The information was included in tonight's packet. Both of those facilities are located along Washingtonian Boulevard. The first one is roughly does have an address. It's at 9841 Washington Boulevard. It'll be a 30-foot tall steel street light in the median. Again, that's, I believe, the existing height of that street light or close to it. That location is opposite of the Waterfront Place in Rio. The second one will be a slightly smaller, which is along the lines of our decorative poles, which will be 24 feet in height. And that is located on the southwestern side of the traffic circle at Grand Corner Avenue, as you're in the right-of-way of Washingtonian Boulevard. I will note that there are also two others that are pending that staff are working on. These are slightly different in terms of the small cell facilities. They'll be located on Pepco wooden poles. So they are located more in the Old Town area. One will be located in front of 35 North Summit Avenue. And there'll be another one on near Chestnut Street near North Frederick Avenue. So this has been a long time coming in terms of the regulations that we put in place, and they are in compliance with the regulations, sticking to arterials and collectors within the community. And that's it.
Thank you for that update, Dennis. I see Rob Wu's hand. Go ahead, Rob.
Thanks, Mary. And I'll be brief. Dennis, thank you for the FYI. Is there any plans to notify any proximate residences to the planned installations?
We do have a portion in the code that we notify adjacent property owners. Again, these currently are the two that were going to be installed in Washingtonian aren't against any residential neighborhoods. And I'll have to look closer at the one on Chestnut Street, but I don't believe it's close to any residential properties. They are close to commercial properties, but we will not do any grand notification other than updating our website of these locations as we approve them.
Okay, thank you. I mean, if they are close, relatively close to residential, my druthers would be to put out some kind of notification to the public. Other question as kind of an aside, has there been any determination about the Crown Castle facility that's on Seneca?
That would not be in our right of way. If it's actually on the right of way of Great Seneca. I know we were still working with them on a pole that's a little bit further back, and I'm not sure we made a determination. Lynn, I don't know if you have any more update on that. I don't, so.
Okay.
All right. We'll go to Mike.
Just one last, I'm sorry. I'm pretty sure in our last conversation that's actually on our property. So it's not in our right of way, it's on our property.
There's some issue that it's on Pepco's easement, who has the right to put up utility poles and then also farm out their easement to other utility providers or other users. So it's a little bit more complicated than just being on our property.
Okay.
All right, well, you know what, Dennis, if there's more
I
information.
can provide, yeah.
Yeah, send us more info on that, because that is an interesting development, I think. Mike, go ahead.
Yeah, so the tower at Grand Corner, at the circle at Grand Corner there on the south side of Washingtonian Boulevard, would appear to be adjacent to the residential neighborhood there. And what is that, Sawyer? The Sawyer Apartments or townhomes or something like that.
Which is not in the city.
It's not in the city, but they are residential, and they should probably be notified, Mike. But the other question is, how does the placement of that tower, I guess it's on a decorative lamp or light pole. At our last meeting, regular meeting, we just approved a bike lane, bike and pedestrian path plan for that region. How is that going to have an effect on this location?
I would have to look at the plans for the bike plan, and as with most of our leases, if something would happen and it has to be relocated, that would be part of AT&T's requirement to help us with that relocation.
Okay. All right. That's it. Thank
All
you.
right. Anything else from any other staff? There's a few on the screen at the moment. Not seeing any, then I will just remind everybody that next week, March 8th, we have our work session on the master plan update for Lake Forest Mall property, which should be very interesting. Hopefully you could join us Monday, 7:30 p.m. Until next time, let's do great things, Gaithersburg. We are adjourned.